There's no avoiding the fact that the last couple of years have been somewhat challenging. mHIVE has been an excellent forum for young HIV researchers to engage, collaborate and support each other, albeit in a virtual space. As a HIV researcher whose group is located outside Parkville or the Ambrac precinct, this has been extremely important, and it's a credit to the young ECR researchers and the mHIVE committee for their commitment to this forum and the research it represents. As we reach the 90-90-90 goals, we hope that through scientific and social research driven by strong community engagement, all people living with HIV will have a good health-related outcome and a good quality of life. I'd now like to introduce our official address, I would like to introduce our first speaker, Professor Brett Sutton. And I think Professor Sutton needs far less an introduction this year than in previous years. It gives me great pleasure to introduce Professor Sutton to give the opening address. As we know, Professor Sutton is Victoria's Chief Health Officer. He has a variety of statutory functions under health and food-related legislation and provides expert clinical and scientific advice and leadership on issues impacting public health. Professor Sutton has extensive experience and clinical expertise in public health and communicable diseases gained through emergency medicine and field-based international work, including in Afghanistan and Timor. Thank you, Professor Sutton.
Thanks so much, Melissa, and thank you everyone for the opportunity to open today. I'm going to work through my technical bits and try and pull up my talk. Yes, as I say, an absolute pleasure to be here, and what a fantastic theme of living well to work through today with some fantastic speakers. I'd like to start by acknowledging the traditional owners of the land on which I'm coming from, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging, and also to acknowledge all of the traditional owners of the lands on which we're all coming from. I also want to acknowledge all of those living with HIV and everyone who's lost someone to HIV/AIDS. I do also want to acknowledge Professor Sharon Lewin as Director of the Doherty Institute for her pivotal role in HIV research and her international collaborations over many years, and of course our organisers today from Doherty and Burnett and Alfred Health and Living Positive Victoria, and of course representatives from affected community agencies and their executive officers and presidents, and to acknowledge Minister Pakula's presence. So obviously today is a day to show our support for people living with HIV, to commemorate all of those friends, lovers, family members and colleagues who've died, and to acknowledge their stories and the courage in fighting HIV over many years and the continued battle. On behalf of the Victorian Department of Health, I do want to recognise the commitment of everyone here in that ongoing response to end the HIV and AIDS epidemic, and to recognise work really across the world, but with a leading focus in Victoria. We've got many achievements over the last 40 years. There's been a building and refining of health systems, but also importantly the settings and support to include and protect people in disclosing and managing their status better, and the long-term effectiveness of our care responses and health of people with HIV, and to work on the ongoing impact of stigma and discrimination, which is really part of moving to that space of living well with HIV. And we really do need to frame that idea of wellness in the fullest sense, including living without the stigma and discrimination that, looking back on these 40 years, has been a journey, and there have been some terrible years. In 1981, after the first reports of PCP, as it was in California, it took 4 years for Ronald Reagan to mention the word AIDS in his presidency. The ostracism and vilification and stigmatisation of those with HIV was profound at that point. But there's been so much progress through the years. So from those first antiretrovirals being available in 87, the first World AIDS Day in 88, strategies in Australia finally developed, and then those clinical improvements to understand viral load, to host, and I remember it well, the AIDS conference in 2014. Such fantastic coming together to focus on all of those elements of care and addressing stigma and marginalisation. Of course, that fantastic development of Pronto and testing and peer support, and then so many more developments, too many to name really. We are moving to a space where we're really looking at genuinely living well with the virus, but there are ongoing challenges. They are clinical in a not insubstantial part, but there are all of those other aspects that relate to the structural, legislative and other constraints in terms of that fullness in living well. And there's been work in Victoria, obviously, in removing AIDS as a notifiable infectious disease, but there's further work that's underway and that'll hopefully come to fruition next year on the removal of HIV as a specific reference in the Public Health and Wellbeing Act. And obviously there's been the reforms in sex work and their intersection with HIV. The conference in 2014 was a fantastic coming together of so many. There were thousands and thousands of delegates. And again, I want to recognise Professor Lewin, who, along with Françoise Barré-Sinoussi, were exemplary co-chairs of this remarkable event. It really was a pivotal moment. It led to Australian health ministers endorsing that virtual elimination of new HIV transmissions by 2020, and to set us some appropriately ambitious targets. And we continue with that. The conference opened a policy window, and we've seen some of those new innovations, technical, but they also need to move through those somewhat held back by often medical inertia or the medical community's inertia, not the broader community, certainly not the HIV community's inertia. They pushed us and advocated for those technical innovations to become scaled up and to be accessible for individuals to really shift the way in which people can live with HIV and can move through their lives in a more fulsome way with respect to wellbeing. So the epidemiology of HIV over years in Australia has really been, reflected by those early challenging years. Very many people affected, but in recent years, a really significant decline. And the significance of that has really been in the scale up towards those ambitious targets that we've had in terms of people understanding their diagnosis and getting access to antiretroviral treatment, having that undetectable viral load, and more in the prevention space, especially with the development of pre-exposure prophylaxis and treatment as prevention. But we shouldn't forget that this remains a significant challenge globally, with 37.7 million people living with HIV. Yes, a significant number of those, 28 million plus, with access to ART, but with 1.5 million new diagnoses each year, and a cumulative total that is really breathtaking if we take the time to contemplate it, of 36 million deaths. It really is one of those numbers where it's too big to apprehend appropriately, but it is worth taking a moment to really recognise that that is really quite an extraordinary loss to the world, and that challenge is not over. Pre-exposure prophylaxis, or PrEP, has been a really significant development in our management of HIV, and you can see that the scale up from those early days in 2018 has really changed significantly. Again, not the last of the innovations that we'll see, but a really important one to have that early research, translated into policy and implementation and appropriate scale up, because it makes a difference in people's lives. There's been fantastic work in Victoria with a community and peer-led response, again, led by community, led by the community agencies that understand what it means for people to have that peer support, peer engagement, and the peer communication that allows them to understand what's available to them in terms of care, and to understand how they can move through that that journey to the full wellness that we want for everyone. And we have been at the forefront of research, clinical and community-led responses in Victoria through Alfred Health, through the Doherty and Burnett Institutes, Thorn Harbour Health, Living Positive Victoria, Positive Women Victoria, and many other agencies. And that translational element is really critical. It is no good to have research that doesn't move quickly through those policy, legislative, regulatory changes that allows for this to become part of those living with HIV and their friends and family, part of their lives, to really create that wellness space that we're all looking to. Since Pronto was established in 2013, there have been more than 18,000 rapid tests, point of care tests that have been performed, and the service has expanded to include screening for other STIs, and obviously led by those trained peer workers, a really important element. So there's been terrific progress against those UNAIDS targets, the 90-90-90 targets. Again, we've got appropriately ambitious targets for 2025, and renewing our HIV, Hep B and Hep C strategies at the moment in the department is part of locking in those aspirations and making sure that we have a plan to reach them. We do want that entirely achievable vision of virtual elimination of new HIV transmissions by 2025. There's ongoing research that's important, work with the NH and MRC partnership project, where phylogenetic analysis as a preventative public health measure is being explored, with the development of an ethical framework, with really intensive community consultation to see whether we can detect through a better understanding of the phylogeny of HIV, so the genetic fingerprinting that might allow us to detect transmission clusters that would otherwise go undetected, and to find additional individuals who might otherwise not be reached in terms of their risk of acquiring HIV. So some important work there. There's work on long-acting HIV treatments. Obviously, the last 2 years has had enormous impacts on how we socialise, our sexual behaviours, but also our access to care, our access to testing. And long-acting HIV treatments are part of that puzzle in responding to some of the care challenges for people who might struggle with a number of barriers to be able to access care that improves their quality of life. Where else to next? We have to recognise that there's an ageing population of those living with HIV. And even though being over 50 isn't old, of course it's not old, we do need to recognise that there is a significant proportion of those living with HIV now estimated to be at 44%, up from 19% in 2010. So a really significant demographic shift in those living with HIV. And the Well Beyond 50 website is part of allowing people to find a portal to find HIV resources on common health issues, meeting other people over 50 who are living with HIV, and planning for the future. And obviously, you'll hear today some of the research that recognises that we need to address those other wellbeing challenges in an ageing cohort who are living with HIV. A cohort that's at nearly 10,000 people now. And so there are lots of areas to continue to look at. And one of them is looking for an HIV cure. a cure or a functional cure for HIV, or a way for patients to safely stop taking antiretrovirals that, of course, have their own wellbeing burden, and to keep their virus under control, will have a significant impact. The science is promising that we can put HIV into remission, find a way for people to safely stop ART and not be committed to lifelong therapy. The optimism comes through a growing number of cases demonstrating that remission in HIV, although rare, is possible, and that provides a seed for us, again, to aspire to have that scalable and to recognise that the many millions of people living with HIV globally, that this might be a pathway for them. I would again remind everyone here that we do need to lift our eyes up to the horizon. We need to recognise that this is a significant global challenge, and that whatever we find in Victoria, we need to turn our attention to the issues of equity, especially global equity. And as we'd all be aware, in the last few days, vaccine equity and the Omicron variant with coronavirus has brought to bear how important it is for us. And we can think about it selfishly, but we should also think about it in terms of what it means for the billions of people globally and what it would mean for them. And again, Prof. Lewin and Prof. Bare-Sanusi in their international work and policy focus, really important to recognise at this point in time. You've got a lot of fantastic presentations ahead, so I won't hold you any longer. I'd like to really recognise the fantastic work of all of those who are working in community support, community advocacy, but also these important research areas that you'll hear about today. I hope you have a fantastic day. And again, it's been my pleasure to be able to be part of opening it. Thank you so much.
Thank you, Brett. Thank you for that wonderful opening, Brett.